Patient name, Son Goku. Age, 24. Presenting complaint, severe muscle spasms, internal hemorrhaging, and glowing red skin. We all know the move. The Kaioken. It multiplies your power, your speed, and your senses. But as a medical student, whenever I watch Goku use this technique, I don't see a cool power-up. I see a medical emergency. Today, we're going to calculate the actual toll the Kaioken takes on a biological body. We're going to look at the hemodynamics, the cardiac output, and the sheer physics of blood pressure to answer one simple question. Why didn't Goku's heart explode on planet Namek? First, let's define the Kaioken medically. King Kai describes it as a momentary amplification of all bodily attributes. In medical terms, this is an acute, massive activation of the sympathetic nervous system. Your body dumps adrenaline. This hits the beta-1 receptors in your heart. This does two physiological things. 1. Chronotropy, your heart beats faster. 2. Inotropy, your heart beats harder. A normal elite athlete has a cardiac output. That's the amount of blood pumped per minute of about 30 to 35 liters during max exertion. But Goku isn't doing max exertion. He is doing Kaioken times 4. If Goku's base max output is, let's be generous, 40 liters per minute, and he pushes his body to a literal times 4 multiplier, we are looking at cardiac output of 160 liters per minute. To put that in perspective, your average bathtub holds about 150 liters. Goku needs to pump an entire bathtub of blood through his heart every single minute. This brings us to Laplace's law. This law governs the wall tension in a hollow cylinder, like a blood vessel. Tension equals pressure times radius. When Goku forces that much blood through his vessels, the pressure skyrockets. To compensate, his vessels must dilate, increase the radius to lower resistance. But according to Laplace, increasing the radius also increases the wall tension. He is in a lose-lose situation. His aorta should technically rip in half like wet tissue paper. This is what we call an aortic dissection. Goku survives this on Namek because Saiyan physiology is durable. But you cannot cheat physics forever. When you subject a heart to high pressure for years, it adapts. The heart muscle gets thicker to push against that pressure. We call this concentric hypertrophy. This is the irony. The stronger the muscle gets, the smaller the chamber becomes. It becomes stiff. It can't fill with blood properly. This is diastolic heart failure. Remember the heart virus in the Android Saga? Pathologically, viruses love to attack damaged tissue. I theorize that the virus was just the final nail in the coffin for a heart that was already destroyed by years of Kaioken abuse. Think about it. Viral myocarditis on top of hypertrophic cardiomyopathy. His heart wasn't just sick. It was a ticking time bomb of scar tissue and thickened muscle, desperately trying to pump bathtubs of blood every minute. So, the diagnosis? Goku suffers from acute, induced hypertension leading to severe concentric hypertrophy. The cure? Stop using the Kaioken. Super Saiyan is much more efficient. It's a metabolic change, not just a hemodynamic overdrive. But that's a diagnosis for another video. If you want to pass your boards, or just understand why your chest hurts when you lift heavy, hit subscribe. Class is dismissed.